Hello, everybody. Good afternoon, and welcome to a weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Public Information Officer, and Happy New Year, everyone. This is our first media briefing for 2024, and we would like to welcome Dr. Keisha Davis, the county's health officer, as well as Dr. James Bridgers, who is the Director of the Department of Health and Human Services. We have with us Mr. Sean O'Donnell, Acting Deputy Chief of Public Health Services, also from HHS, and Dr. Earl Stoddard, who is Assistant Chief Administrative Officer for the county. We have two special guests today, Ruthie Fishman. She's Special Projects Manager for Cedar Creek Memory Care Homes. Welcome, Ruthie. And we also have with us today Chris Conkling, who is the Director of the Department of Transportation for the county, and he is here to answer any questions the media might have regarding the preparation for the potential winter storm this upcoming weekend. Members of the media, we're recording this meeting, and let's get started. Good afternoon, Mr. County Executive.
Good afternoon. Happy New Year to everybody, and thank you again for joining us. So let's start with the earthquake. Earlier Tuesday morning, around the Lakewood Country Club in Rockville, was the epicenter of a small 2.3 magnitude earthquake. The United States Geological Survey heard from about 1,000 people about the quake, and it was at a depth of about 50,000 feet, which was the deepest earthquake recorded in Maryland going back more than 25 years, and the largest in our area since the 3.4 magnitude earthquake that hit our region in the summer of 2010. I actually remember that because I was in the office building in Rockville and remember the building swaying and how odd that felt to feel a building sway. This time, I think me and most other people slept through it. So a lot of us woke up to news about this earthquake. Thankfully, no damage or injuries were reported. There have been reports of people indicating they felt their house shake and that the quake did wake them up. And the event's a reminder that we all need to know what to do during an earthquake. And everyone can look in our weekly newsletter to know what to do. We're going to put a little section in there to give people guidance for how to handle themselves during an earthquake. And you can also sign up for Alert Montgomery. And speaking of being prepared, we're preparing for this weekend's possible snowstorm, more likely a snow event that could bring snow and ice to the region. The National Weather Service says there's a slight winter storm threat. If you're like me and checking your weather, various weather apps, you'll see that there's not much snow projected at this point, but there is a possibility, as happened before, if the track changes a little bit for the storm, it could wind up to be worse than anticipated right now. The storm could impact parts of Montgomery County starting Saturday morning. And if needed, the county will open the Storm Operations Center to respond to emergency requests for service. Rely on official observation stations at major airports to track snow. We're approaching about 2 years since even recording an inch of snow at national or BWI. And as often happens, it's quite possible there'll be a lot of traffic at pharmacies, grocery, and hardware stores as people prepare for a storm. I think we've all been through this drill before. We encourage residents to be prepared. That can include preparing an emergency kit for your home or car. A 3-day supply of food, water, and medication is recommended, along with supplies to keep you self-sufficient if needed. Like any storm, MCDOT's priority will be to maintain access to public health facilities on major roadways. The state takes care of major roads like I-270, 29, Route 355, while the county DOT focuses on everything else that's not a state road. And we're responsible for more than 200 plow routes across 5,200 miles in the county. During every storm, we ask that everyone avoid driving unless it's absolutely necessary. Crews on the road need room to lay salt or clear snow, so please give them plenty of room to operate and be patient. The storm could bring us snow and others, maybe just rain, but gusty winds are expected across Montgomery County. You can get up to date on our response by checking our snow page at montgomerycountymd.gov/snow. You can find links to learn how the storm impacts all our departments, programs, and activities. And I want to thank Chris Conklin and Richard Dorsey from MC Dot for being on the briefing today in case you have any questions about how we're preparing for this potential winter weather. And finally, we have our community health report. There's once again rising concern about COVID-19 as all respiratory illnesses like flu and RSV. Last week, the Maryland Department of Health issued new recommendations for all clinicians, including doctors' offices, long-term care facilities, healthcare settings, and hospitals because of the new data showing elevated hospitalization rates. Since the start of December, Maryland's combined hospitalization rates have been above 10 per 100,000 residents. And here in Montgomery County, we're seeing a rise in flu and COVID-19 and more COVID-19 cases in our hospitals. The new state recommendations highly recommend the use of masks in clinical settings such as hospitals, offices, and clinical spaces. And to be clear, the Maryland Health Department is not mandating these recommendations, but strongly recommending them. And we're asking staff and clients visiting any of our clinical services to wear a mask as well. When the COVID-19 pandemic began, nursing homes were among the first to feel the impact of COVID in Montgomery County. Long before we had vaccine, a disproportionate number of outbreaks and deaths came from these congregate settings. And the population has always been our priority from the beginning of the pandemic, and it continues to be our focus today. Nearly 20% of COVID deaths in Montgomery County were in assisted living facilities. That's nearly 500 of our neighbors. And in Montgomery County, there are more than 200 long-term care facilities, including nursing homes, assisted living facilities, and we work closely with them to provide critically needed personal protective equipment, including masks, gloves, and other items. Fortunately, we're not in that space right now. From the beginning of the pandemic through the initial vaccination process, we had a team of nurses detailed to work directly with these facilities. We dedicated vaccine doses to these high-risk individuals and those who care for them. On the county level, we've been working with our long-term care facilities to make sure they're prepared now. And we're still keeping track of vaccine rates, especially in places where large numbers of people live. A few weeks ago in this briefing, we started sharing how important 100% or near 100% compliance was for these facilities. And I want to welcome Ruthie Fishman to join me today. She is the Special Projects Manager for Cedar Creek Memory Care Homes. Cedar Creek has 5 memory care homes in Montgomery County, and like many other long-term facilities, they were hit hard by COVID. They're reporting 100% COVID vaccination rate among staff and patients at 3 of their facilities. I invited Ruthie here so she can kind of share their story, and they set an example for all of us. Hopefully, this is something that all of the long-term care facilities will replicate in the not too distant future. So I'll turn this over to Ruthie now and talk a little bit about nursing home COVID-19 vaccination rates. So thank you for joining us.
Thank you, Mr. County Executive, and thank you to everyone on the call today. It's always so encouraging to be invited to talk about something positive. Over the last few years, there's been obviously so much negativity around COVID-19, and it's been so much of a hardship. So it's great to be invited to talk about something positive. I will say that I think our current success with the vaccination rate at our homes, both with staff and residents, as you mentioned, I think unfortunately it does stem from being hit so early on. But we've been able to turn that challenge that we went through in the beginning into kind of, the reason for us really encouraging the vaccination rate to be as high as it is. Just to give a quick background, we were one of the facilities in Montgomery County, like many, that were hit back in late March, early April 2020, when we didn't have a lot of information. We didn't have testing, we didn't have masks, we didn't have gloves, we didn't have the basic things that were needed. So we were hit really hard at one of our 5 memory care homes, and we lost a good amount of residents. And then we were kind of in one of those spaces where we were doing everything. We were driving to dentist's office to pick up gloves and gowns, and working with the county to get supplies, and just we were putting trailers in the parking lots of our facilities to put our staff up. But it was really tough. We got to the point where all of our staff at one of our homes was out sick with COVID, and it was just the other director and myself taking care of all of the residents, and it was tough. Fast forward a couple months, end of the year, December 2020 into the beginning of January 2021, and another one of our homes was hit, and again we lost a good amount of residents to the virus. At this point, despite having a lot more resources, masks, understanding isolation, testing, and all of that, but given the fact that we were memory care, we couldn't, our residents couldn't wash their hands, the way they needed to. They couldn't keep a mask on. We couldn't keep them isolated effectively. And so we lost, as I mentioned, we lost a number of residents. At this point, the vaccine was just becoming available. And so we made it our absolute mission to get everybody vaccinated. And it was not, I think the thing for us that helped was it was not a you have to do this. It was not a mandated, this is a requirement, another thing you have to do. It was you get to do this. We are going to get you the vaccine. We're going to help you get this vaccine. We're going to drive you to the appointments. We're going to sign you up online. We're going to shuttle you back and forth. We're going to bring your family if we need to. Whatever we can do to help you get this vaccine. It's a privilege to be able to have it. And we set that as the culture, and that's just what we've continued for the boosters and everything moving forward. It felt a lot like we were on the front lines, without any armor, and then this was our armor. And now fast forward again, obviously the virus continues to enter our homes as it enters everywhere, but we just are not having the same devastating results that we did before the vaccine. And so that story just speaks for itself. Our residents, our families, our staff see that, and they want to do everything possible to not have a repeat of what we went through in 2020. So that's our story, and that's what we continue to try to do. And I hope that other facilities, are able to try to do that as well. And I think many are. I think a lot of people, our story is not, totally unique. Of course, a lot of people have gone through this. And so thank you again for letting us share the story. Like I said, it's great to be highlighted for something good during this time.
Thank you very much. And you all have done great work, and you should be an inspiration to other facilities. And if as this gets reported out, I hope that one of the things people realize that folks who've got family members in these facilities have the ability to ask them to take the kind of steps that they've taken at Cedar Creek to make sure that all their staff gets vaccinated, and make sure they make a push to get their residents to agree to take the vaccine. It would benefit all of us, and it would be really unfortunate to look at different rates of illness and death across different centers based on who decided to get their employees vaccinated and who didn't. As we've been saying for a while now, death from COVID is pretty much preventable if you get shot, a shot, I should say. And, so the idea that we have to face more deaths is like unnecessary if everybody does the kind of things they need to do. So thank you for being on today. I'm going to turn this over to our health leaders, and then we'll take questions from the media.
Thank you, Mr. County Executive. I will just share a couple updates from what we're seeing, because we are at a point where we have higher rates than we have at almost any point until we go back to January of last year. The graph at the top is showing our outpatient visits to Montgomery County hospitals. These are visits for any respiratory illness. And right now, I'm going to show you some data showing that influenza cases are on the rise, COVID cases are on the rise. And so, we have a lot of different respiratory viruses going out there. We want to emphasize, if you have if you test for COVID and it comes back negative with a rapid test, please wait 24 hours and do another test. Sometimes those will come back positive at that point. Also, just because it's not COVID doesn't mean it isn't a dangerous respiratory illness. So again, you can see that these numbers are very high. At the bottom, those are our COVID outpatient diagnoses, and you can see at almost every age group, they're going up right now. We expect that to continue for another few weeks, very likely, as this disease continues to spread post-holiday gatherings. It's a good time to emphasize, as we've done at this time in the past, that if you are a vulnerable person, if you're a senior or have underlying conditions that make you more vulnerable, to COVID or respiratory disease, please try to avoid indoor crowded spaces right now, or wear a mask if you need to go to them, just to protect yourself from these respiratory diseases that are very common right now. Again, our hospitalization numbers have gone up at the state level as well. Our county executive shared with you that they're rising in Montgomery County, and the emergency department visits, hospitalization numbers are both going up. These are national numbers. You can see that they've been increasing. We saw a little dip around the holidays, as usually around holidays, people try to avoid going to hospitals and seeking health care, and then we see an increase right after the holidays. Our flu numbers, as you can see, are continuing to climb within the county. And across the state, you can see right now that that number is going up, as it has in previous years in December and January. And again, we just want to highlight the long-term care facilities that have gotten a lot of their residents vaccinated. We continue to work with a very large number of these to try to increase vaccinations. We have calls with them daily. Again, Cedar Creek, as you can see, has been doing a marvelous job, and we really commend them for their efforts on behalf of their residents and their staff. So thank you very, very much. At this time, I'd like to see if we have any additional comments from our health officer, Dr. Davis, or our director, Dr. Bridgers.
Thank you, Mr. O'Donnell. No additional comments from me. Ready for the Q&A.
Yep, thank you, Mr. O'Donnell. Just reiterating again the importance of vaccination. It is still a tool that we use. We are right in the thick of COVID and flu and RSV and all of the other common colds that come this season, and this is to be expected in January. We see this. We've seen this for the last couple of years. I do want to encourage. We've been hearing cases of people feeling like their cold symptoms are lasting for a long time. Part of that is people are getting sick with one thing and then another thing comes right on top of it before they're completely healed. So they get a cold and then they get RSV and then they get the flu. But I do want to encourage folks, if you feel like your illness is lasting longer than it should, that you should consult your primary care doctor about that. So most people think they're supposed to be sick for 3 to 4 days. Reality is that most people are really sick for 10 to 14 days. And if it's lasting longer than that, then you should definitely consult your primary care physician.
Thank you, Dr. Davis. Members of the media, we are going to open it up right now for questions regarding the public health update and or questions for our guest, Ms. Fishman. Please raise your hand and we'll call on you if you have any questions. Jeannie Bixby, Local 360, good afternoon. You have questions?
Yes, good afternoon. I was wondering, Mr. O'Donnell, Dr. Bridgers, Dr. Davis, anyone involved, what kind of are the recommendations that we're making beyond just making sure you're up to date on your vaccines to the community? Should people be taking additional caution coming home from the holidays? What should we be telling our readers?
Yeah, go ahead, Dr. Davis.
So I was just going to say, so the things that we always should be doing, washing our hands, covering your cough or sneeze, stay home when you're sick. I think this is the biggest thing, is to stay home when you're sick. Take advantage of that COVID test. If the COVID test is positive, then you certainly want to stay home and isolate. But even if the COVID test is negative, you not spreading that infection to somebody else is kind of the best gift that you can give. And if the symptoms seem to be progressing, so shortness of breath, chest pain, inability to keep down food, getting dehydrated, those are all things that you should be, consulting with your doctor about. I do want to remind folks that you don't necessarily have to run to urgent care or the ER right away. You should be calling your primary care practice and asking if you are feeling sick, do they need you to come in? There's a lot that can be done via telehealth so that we're not overloading our hospitals and urgent cares unnecessarily.
Thank you.
Thank you, Ginny. Suzanne Pollack, Montgomery Community Media, good afternoon.
Good afternoon, thanks. I just wanted to find out if the vaccination rate is going up at all, if people are doing that, and is the county preparing to do any kind of push for higher vaccination rates?
So we have been monitoring the vaccination rates again across the county. They're not being reported the same way they used to, but we do run reports to see they go up. It's not anywhere near what we've seen in previous years. However, we are seeing that our seniors are vaccinated at a higher rate than many of our other ages. And we want to remind people that the booster this year is recommended for all ages. This is an updated booster this year. It's a monovalent, and it's been formulated specifically for the more recent variants that are going on. The county, once in this fall, when the vaccination process was privatized, the county's role and public health's role across the United States has shifted to a more common role that we've had in the past, working with our uninsured populations, helping them get access to vaccines, whereas most other populations now will go through the private healthcare system to get that vaccination. And I do want to mention, we've said this on some of the previous briefings, it was difficult early on to get a vaccination. It was difficult to make an appointment sometimes, and it was difficult sometimes working through your insurance providers to ensure that you had coverage. That has gotten a lot easier in recent weeks. So we want to remind people, if they had a little bit of a difficulty early on getting that vaccination, please reach out. Most pharmacies carry it. If you, depending on your insurance, you may want to talk with your insurance provider to figure out where they cover that care. That's true of not just COVID vaccinations, but a lot of different services you receive. So, for example, I have Kaiser, and I had to go to Kaiser to get my vaccination, but there was no charge to me to do that. Some people can go to different pharmacies as well. So it will help if you either contact your healthcare provider or your insurance company to figure out what the easiest method is.
Is that good, Suzanne? Okay.
Yes, thank you.
Okay, thank you. Members of the media, any more questions for health officers and or Ms. Fishman at this time? Jeannie, I see your hand up again.
Hi, yes, I'm back. I was curious how we're doing on tests. Is there a shortage of tests? How are people able to access COVID tests, et cetera?
So there's a variety of different ways people can get tests. Of course, they are covered through insurance. Our federal partners continue to send them out free of charge, up to 8 per household. I just ordered some for my parents yesterday. I ordered some to be delivered to my house. I know it will take a few weeks. We've had them out at our libraries, and right now we're working with our county partners on distribution plans to continue to make these available. But again, we encourage people to utilize their insurance and other options to get the tests that are covered by their plans.
Great. Thank you so much.
Thank you. Suzanne, your hand's still up. You have follow-up questions or you're good for now?
I'm good, sorry.
Okay, no worries. Thank you. Any more questions regarding public health? No questions for Ms. Fishman? Okay. Well, Ms. Fishman, thank you so much for joining us today. You can remain on the call if you'd like to, or if you need to move on to work, well, we'll say goodbye now. Have a great afternoon. Mr. County Executive, other topics.
I am through my topics for today. Today was light breezy. We've had a relatively calm week and quiet week, and so nothing new to announce. But we are going to be doing a briefing on the 16th on the capital budget. There are going to be some other significant announcements, I think, related to that. We're actually looking forward to what we're going to be doing in the coming year, and I think people are going to be very interested in some of the direction we're taking off in. And we continue to work closely with the new administration under Governor Moore, and we're very happy about the level of cooperation that we are finding. So I will just say thank you all for being here, and talk to you again next week.
All right, no more questions regarding any other topics? Oh, I see Suzanne Pollock has her hand up.
Okay, sorry.
Any other topics? This is the time, members of the media, and also if you have questions regarding the county's preparations for the potential winter storm this weekend. Suzanne.
On another topic of all those, I see that it's only the third day of the new year, and we've already had our first fatal accident. And I was just curious if Vision Zero is still something that we're backing, or that we're wondering if it's working, or do you have any comments on how to end some of this?
So I'm not sure which accident or what accident you're talking about. So, but I don't doubt that there's an accident. Look, we are doing all the things that we can do, and we continue to look at intersection improvements. We continue to look at lighting improvements. We understand that there are changes that need to be made. We also need greater pedestrian awareness of when it's safe to cross and when it's not safe to cross. There's nothing we're ever going to be able to do to protect people who make bad decisions. What we need to do is make sure the drivers don't make bad decisions. I'm hoping, we've talked before about the incident with the driver who, cost one of our police officers both his legs, that we want enforcement at a level that things are treated not as traffic violations, but as criminal violations when behavior gets to the point where a person's behavior is outright dangerous. It is way different than having an accident. It's another thing when you're driving like a maniac in utter disregard for the health and well-being of other people. And we need to start understanding that and treating those kind of incidents with the seriousness they deserve. But I don't, we don't have a magic wand. It is a national problem, a regional problem, and it's our problem. And we're working on it.
I just want to clarify, I read at the bottom of the press release, this was from a December 26th accident. They just sent out the press release today. So
okay, so we're not having our first one yet.
Sorry about that.
Yeah. And that one was, I think I mentioned at the time, that was the one where the person crossed the street against the light.
Yeah.
And there's no pedestrian safety thing you can do if somebody decides they're going to cross the street and walk into traffic like that. It's, that's just really hard to prevent.
Yes. All right, thanks, and sorry about that.
It's okay.
Thank you, Suzanne. Members of the media, any more questions for the county executive and or the officials this afternoon? No more questions? Going once? Going twice? Well, thanks for joining us. Thank you, everybody. Have a great afternoon. Stay safe, and we'll see you again next time.
Thank you all. Bye-bye.